We're going to talk about the OSCE, which is the part 2 of the test of competence, a requirement by the Nurses and Midwifery Council of the UK, okay, for internationally trained nurses to be able to register with the council. All right. So quickly, I just want to give an overview. It's basically a 10-station practical exam. All right. 10-station practical exams. And by talking about 10-station practical exams, what I mean is that we have series of stations that you have to go through to be done with the OSCE examination. And then to list them quickly as an overview, we have the assessment, planning, implementation, evaluation, physical observation phase, de-escalation, talking therapies, reminiscence therapies, professional values, evidence-based practice, and the nutritional assessment station. All right. So it's 12 stations that you are going to get 10 out of the 12 stations. Okay. So there may be 2 stations which you will not do. Okay. You may have either these 2 sets or these 2 sets, right? So, but then I'll quickly try to hit on what these stations represent. All right. So the assessment phase, that is, so basically is the nursing process that we know already. That is the API, where you have assessment, planning, implementation, and evaluation. That is constitute the nursing process that we know. In some jurisdiction, they have ADPI, where you have assessment, diagnosis, planning, implementation, and evaluation. But then with this, it's API, A-P-I-E, assessment, planning, implementation, and evaluation. All right. So with assessment phase, what you are supposed to do is you will be given an actor who is going to act as a patient for you to interview. All right. And then be able to come out with some problem that a person is having. And by coming out with these problems, it will be able to help you to lead to the second phase of the nursing process, which is the planning phase. And so the assessment is one station on its own. With the OSCE exams, assessment is one station, and then when you move on to the planning phase, it's also another station on its own. All right. So the planning phase is to use all the problems you elicited during the assessment phase to plan. At least you should get 2 major problems which you are going to plan on. All right. So you are going to, with the planning, you have a care plan. Okay. And the care plan, you have a diagnosis aspect where you are going to diagnose the problem. You are going to have your aim for this particular problem that you want to solve. What do you want to achieve, the time period you want to allocate for achieving that problem, and the very basic things you are going to do to really be able to achieve that problem. That constitute the planning. So you do one care plan for one problem, and then another care plan for the second problem. All right. So that is assessment and planning phase. And for you, now we move on to the I, which is the implementation phase. With the implementation phase in OSCE, what you'll be doing is you're going to administer medication. That is, you have assessed your patient, you have planned it, so this time you're going to implement, and it's basically administration of medication. So you go through a series of checks, the very checks we know, the rights, about 10 rights. In some jurisdiction, a whole lot of rights: right patient, right drug, right route, right time of administering the medication, right dosage, and just these rights. You have to be sure of these rights before you move on. The right prescription and all that before you go on to be able to serve or administer the medication that you have been given. All right. So that is basically what you do at the implementation phase. So you are supposed to take very good care of whatever you are going to administer. Be sure you have the right prescription, and you know whether the person is not having allergies to some medications you are going to administer, and be sure that there are no medication risk factors to such medication that you are going to administer, where you are going to escalate and all that. So that is what goes on at the implementation phase of the OSCE, that is the implementation station of the OSCE. Then you move on to the E, which is the evaluation phase. And with the OSCE evaluation phase, this is what you're going to do. You're going to hand over the patient that you have assessed, planned, and then given some medication to. You're going to hand that patient over to another nurse for continuity of care, basically. And then with the evaluation phase, you're going to go by the S-bar formats, and it's a structured way of being able to hand over the patient to the person, where you're going to introduce yourself, mention the patient you are going to hand over, and then give a brief info about the patient, that is the biodata about the patient, all right? And then if the person is having any allergy of that sort, then you give a full background of what has actually happened, whatever has gone on with the patient, the problems he has presented to you, and all that. You talk about that during the B aspect. And then you also go to mention the plan that so you're going to mention the plan that you did for the person during the period. So when you were planning, you mention all the plan. You literally mention all the things you have stated in your care plan to the person that you are going to hand over to. And then if there are things that you actually wrote in your care plan but you were unable to do, that you want the person to continue with, you also have to relay that information, and then you hand over the person to. That happens at the evaluation phase of the OSCE, all right? Okay, then we move on to physical observation. So we are now out of the API, where the assessment, planning, implementation, and evaluation, right? We are done with that. Then you're going to move on to physical observation. Basically, the physical observation, as we know, is to check the patient's temperature, pulse, respiration, blood pressure, oxygen saturation, level of consciousness, okay? And then you're going to record these values on the NUS2 chart, and then you calculate your NUS2 score, and then be able to explain to the patient what the score means and what you are going to do based on the score that you are going to get from the patient. So that is the physical observation. There is also one separate station in the OSCE examination. All right. Now let's move on. So we move on to the other phase. Like I mentioned, that you have 12 phases, then you are going to get 10, meaning 2 you wouldn't do 2. So there are these 2 stations which you'll be giving one. We have the nutritional assessment station, and then we have the administration of suppository station. Nutritional assessment station and suppository station. So when you are giving nutritional assessment, you will not get the administration of suppository, and vice versa. All right. So let's talk about the nutritional assessment. Nutritional assessment, you'll be given a scenario on paper. It's a written station, I should say, and it's both written and then verbal. Yeah, it's both written and verbal. So you'll be given a scenario to be able to assess whether the patient is having malnutrition. So you're going to calculate the person's BMI. You'll be given the height and then the weight to calculate the BMI, and you'll be given some information about the health risks of the patient and whether the person hasn't eaten for a number of days, and it will be able to help you to give some scores. And then based on the scores, you do some additions, and based on the scores that you're going to get, you will go ahead to do what? Be able to state whether the person is of high risk of malnutrition, medium risk of malnutrition, or a low risk of malnutrition. And based on the risk of malnutrition the person is exhibiting, you can be able to give some form of interventions that you're going to do for the person, and then some education. So after writing and getting your score, you're going to speak out for the examiner to hear the interventions you are going to take based on the score that you have. That is for the nutritional assessment station. Right? Now, let's move on. Then we move on to the administration of suppository. Basically, the administration of suppository is just, I would say, it's also administration of medication, because suppository is medication, basically. So you're going to be given a scenario, and then you have the medication chart with you, where you're going to go through, make sure you are with the right patient, right drug, right dosage, right time of administration, right route of administration. You do all those checks, whether the prescription is valid or is legible, and you make sure you do all those checks. Then you can administer. You can go ahead to administer the suppository and make sure that you are going to do the explanations, the various explanations, because this time you're going to expose the patient. You're going to position the patient in a way that you have access to the enough to be able to put the suppository in it. Mostly they will give you a mannequin which you are going to use as your model, okay, and then you'll be able to open the innards of the mannequin and then insert the suppository. There are some other basic nitty-gritty. I will go into detail in other subsequent videos that I'm going to do. All right, we're going to take the assessment, planning, implementation, and we're going to do it in sessions. All right, so this one I wouldn't go into much detail. All right, now then we move on to the next station, which is de-escalation. All right, the de-escalation phase is a solely written station. All right, so you'll be given a scenario that the patient is becoming blah 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 aggressive here and there. This is psychiatry we are talking about. The patient has been aggressive. How are you going to de-escalate such a person? All right, so you are going to list about 17 points of de-escalating the patient. You're supposed to list everything. You don't have to miss anything in the de-escalation phase. All right, so and there are some key points that the examiner will be looking at for safety. Points that are based on safety. You don't joke with it. If you omit any safety point in your de-escalation, this thing is a red flag. Yeah, it's a red flag. You might not pass. You have to raise it. All right, so let's move on. The next station is talking therapies. Okay, talking therapies, and then reminiscence therapies. All right, talking therapies and reminiscence therapy. Like this is also another two set of therapies that you may be giving one. Okay, so when you are giving talking therapies, you will not be giving the reminiscence therapy, and vice versa. All right, so when you are giving reminiscence therapy, you not give. So let's talk about talking therapies. So the very basic talking therapies that we have the psychotherapy, we have the mindfulness, we have the interpersonal therapy, we have the CBT, that's cognitive behavioral therapy. Yeah, basically, and then you have the counseling. There are 5 talking therapies that we do have. And with this talking therapy, you are going to suggest to the patient a particular therapy which you think will be very okay for such a patient based on the scenario or the problems that the patient presents to you. Okay, so based on the problem the patient presents to you, you will be given a scenario, and then you can choose a particular therapy which fits better, and you speak more to it to the patient and explain it to him. So that is talking therapy for you. And then we talk about reminiscence therapy. Yeah, basically reminiscence is a way of trying to bring back some previous memories of a patient. Okay, and then we would want to focus on very good memories, of course. Yeah, so you'll be giving some materials like pictures, toy dog, yeah, marbles, yeah, and then some for sense. So we are talking about the sense of touch, sense of sound, being able to have. So you have these items, and you'll be given a scenario. You are going to pick items which will be more suitable for the scenario that you have been given. So you go to the patient and you speak to the patient. You try to give the objects that you have at hand to the patient, for the person to feel, for the person to smell, or for the person to hear the sound that the object makes. And then you find out if those sound, pictures, or the object remind him of anything in his past. And yes, obviously you have the patient talking about some of the things that he remembers when he comes into contact with the objects you have based on the scenario you have. So you remember some of the things, and then he will speak up for you to be able to know that these are it. And then you keep on the conversation, elicit more about that, and then try to mention if there's any negative feelings that the things bring. You try to quickly redirect the person's attention from that, and you speak only about the good feelings, the ones that will make the patient happy. Yeah, that is it. Then you try to summarize the whole thing that you have discussed with the patient, and then you close the session. That is reminiscence therapy, very brief of a therapy. Yeah. Then you have the last two therapies we will be talking about: professional values and evidence-based practice. Professional values and evidence-based practice. With these two, you'll be given a scenario. All right. It's also the two of them are written stations. You'll be given a scenario for the professional values, and then you're supposed to use the necessary midwifery code. Okay, the code. Okay, code of professional. So, and then you're going to use prioritizing people, practice effectively, preserve safety, and promote professionalism and trust. To be able to, we're going to use these things to be able to answer the scenario and give your points based on those professional values that you should know. Okay, use this professional value to answer the question. So it's a set of points you are supposed to write down to capture every aspect of what scenario you are being given. Evidence-based is also closely related to the professional value, but here you'll be given set of research findings, for you to, and then a scenario. Then you are supposed to educate your patient on the evidence you have that is going to suit, be able to use it to advise the person, be able to use to counsel the person, be able to use it to point to the person that these are what the evidence are stating. And so this is what you be educating the patients based on that. So you have a set of research findings and which you are going to use to educate the parents. Basically a written station, so you are going to list them in points. I'm going to list them in points that I will advise my patient this. I will tell my patient that this and this and this is the findings, so this is how you're supposed to do. Basically, that is what's evidence-based. So they want you to use the evidence that we have at hand to be able to educate your patient. Alright? Basically, that is it. So those are the stations you will be having. In my subsequent videos, I'm going to talk about them in detail. So we pick assessment and we elaborate more of the assessment. We pick planning, we'll elaborate more. We talk about implementation, evaluation, physical observation, nutritional assessment, administration of suppository, de-escalation, talking therapies, reminiscence therapy, professional values, and evidence-based practice.